This is Ultralife Today. My name is Adam Payne. I am the host of Ultralife Today, and I am also CEO of Ultra Botanica, inventor of the UltraCur technology, and founder of Ultra Botanica. So many things, but I pale in comparison to the man sitting next to me, who is an MD, researcher, acupuncturist, integrative physician, really a man that has I would call it trailblazed integrative medicine on so many levels, and a dear friend of mine, also our chief medical officer of Ultra Botanica, Dr. Brian Frank. Dr. Frank, welcome to Ultralife Today.
Good to be here. Thanks.
Yeah, I don't think we've had you on our primary show, have we?
I thought we recorded a few, but it's good to be here today.
Yeah, not, maybe not as Ultralife Today. We're broadcasting live in Worcester, Massachusetts at WCRN. We're also on KCFO in Tulsa, and we're on KOKC here in Oklahoma City. Mm-hmm. So we're broadcasting in a number of different places, and soon to add maybe Boston and a couple of places in Florida. We're growing, and it's really all because of the UltraCur technology and the LPS patent that came about because of my early work and your efforts really early on in helping us to establish Ultra Botanica. Now, many people don't know that without this guy, we probably wouldn't be here today. So it's your fault, Doc.
Well, it's been a fun story.
It is a fun story.
Yeah.
So back in 2014, we had been collaborating on a couple of different fronts. We met because I was I'd been on a mission trip to Sierra Leone, and I met Richard Hogue on the way back, of all people, and we really connected. I mean, he's not those super pastors. Sometimes they keep a distance to people, right?
Yeah, a lot of times.
A lot of times. But we had time together, and he sat down across from me in the airport in Sierra Leone because we had to wait for an airplane, and he sat down and he looked at me and said, "Tell me about Adam Payne." And I told him all the stories of all the things that God was doing with medicine and eczema and foot wounds and all these things, and he looked at me and said, "You need to meet Dr. Brian Frank."
I'm glad he said that.
And that was a God moment. That really was a moment when I believe God kind of connected things in my life to people that became the foundation of who we are today, or part of the foundation, right? We all participate in building something special. But it was back in 2014 that my early research on curcumin came about, and you were giving a talk. Where was that?
That was in Germany, Berungen, Germany.
Berungen,
yeah. And it was an international laser medicine conference. And the lasers that Dr. Weber had developed initially came out very popular for the use in acupuncture, but then transitioned. He was doing a lot of really high-end work with intravenous laser therapy for a variety of...
Wait a minute. We just talked about this on a different show, but intravenous lasers?
Yeah, that's right. And so some...
What, you're like taking a laser and you're sticking it into the vein?
Well, we insert a cannula just like you would an intravenous fluid. But once you get the cannula in, he also developed a fiber optic cannula that went into the IV site, and then that hooked up to your fiber optic laser.
That makes sense.
And so in doing that, it has some tremendous benefits for autoimmune conditions, for infectious diseases, for cancer, and so forth. And curcumin is a botanical that enhances the laser's effect to either help eradicate bacteria, viruses, and so forth, or to help stimulate in a positive way cellular immunity.
So the curcumin actually, and other botanical materials, right?
True.
But curcumin being kind of one of the major ones, it sensitizes specific cells to the laser light. That's why they call it a photosensitizer.
Right. So it makes the clinical effect enhanced.
Much more profound.
Right. Mm-hmm.
Yeah. And they were using intravenous curcumin before you presented.
Right. And that's a bit tedious.
Yeah.
And obviously involves an intravenous insertion. And when I presented the liquid
Protein
scaffolding technology and the ultra bioavailability, they were very excited because what they saw in that was the possibility that they could get blood levels of curcumin to enhance the laser light effect, but without having to start an intravenous line.
Well,
so they could do it orally.
So yeah, and you presented it, and they actually loved it.
Yeah, they did. They and a number of the physicians there tried samples, and within an hour or two, some of their back pains and knee pains
were gone,
resolved. Yeah. But then in the laser clinic of his, they found that they were able to do that much cheaper and much less invasive.
Right, you just take a pill before the procedure.
Exactly.
Yeah, it makes sense. You know, curcumin has so many different domains of improving the health of people. A lot of us just think about curcumin as a way to modulate healthy inflammation in the body. Curcumin uniquely binds to the NF-kappa beta pathway inside the cell. That pathway is like the gas engine for inflammation. If NF-kappa beta is activated, a cell is signaling that it's in trouble, and it's causing cells to come into to help it. Immune cells to the rescue. It's dialing 911. So when curcumin attaches to NF-kappa beta, it's actually like a perfect lock and key. I told chemistry wise, it slows down the signaling of NF-kappa beta, which causes the inflammation signal to be reduced dramatically, allowing the cells to heal, regenerate, restore. We call it a Th1 to Th2 response. Doesn't mean much to many people, but it's actually moving from an attack mode of inflammation to a restore mode of inflammation. But more interestingly, we've known for a while that curcumin also affects blood sugar levels.
Yeah, that's right.
Right? So, and we've used it off-label. There actually isn't an indication for curcumin, so I'm really off-label because it's a nutritional supplement. And doctors have been using the concentrated forms of curcumin in order to help support healthier blood sugar levels in the body. And this has always been in the back of my mind, right?
Yeah.
We've also used berberine for the same purposes, and berberine has the same problems that curcumin has. It's a polyphenolic compound. It doesn't absorb into the body. And guess what? We use liquid protein scaffolding on berberine in order to get that into the body. And so sitting in the background of our minds going through COVID and into last year, we had curcumin, which we knew was a game changer potentially for blood sugar levels. We also knew about berberine because we actually have done some research with berberine in blood sugar levels. And then you come to us, Doc, saying, hey, I want a product being made. So tell us a little bit about the background of what is ultra metabolic and why is this kind of a breakthrough product for us to take a look at?
Well, Ultra Metabolic is our new Ultra Botanica product to primarily address diabetes and insulin resistance. Either of those are appropriate indications. And so the botanicals largely come from an Indian Ayurvedic tradition,
right,
which is thousands of years old. And there are, 10 or 12 different botanicals in the product that, in addition to the curcumin and berberine, are historically known for thousands of years to be of benefit for metabolism and blood sugar and so forth. And
so not just like lowering blood sugar, but supporting better cellular health on a multiple fronts.
Yeah. Even for patients that have insulin resistance, they don't need to take as much, but it can help that. And so that's kind of a pre-diabetic type condition. So
when that A1C is kind of creeping up a little bit.
Now. Yeah. And in terms of our patients that we do natural bioidentical hormone therapy with,
Uh-huh.
the times when we see in women have elevated testosterone, the number one reason that they have that is because they have a partner that is using a topical testosterone and putting it where she gets it.
Ah,
And a man's testosterone cream is much, much, much more,
super potent.
20 to 50 times the potency of a woman's. So it's very potent. And they can actually, if a guy puts it on his arm or his leg, he can share that really up to 24 hours.
Oh, wow.
And so
that can be dangerous.
It could blast the woman's testosterone level. But the second reason for a woman to have an elevated testosterone level, if she doesn't have a partner that's using a topical, the second reason is insulin resistance.
So tell me, but this is new information to me. Why would insulin resistance result in this kind of effect?
I wish I knew all of the biochemical pathways there. I just know clinically that's the correlation.
Okay.
Is if you see an elevated testosterone in women.
Yeah.
And of course, at our clinic, we look at, we do our hormone tests very comprehensively. So in both men and women, we're going to look at estrogen, progesterone, testosterone, and DHEA. And then, of course, first time and once a year, we look at their adrenal cortisols. So when we look at that, if we see an elevated testosterone in a woman, first thing to find out is if she has a partner that's using a topical that she may be coming into contact with. It could even be perhaps on the clothing that he's worn and she's doing the laundry.
Sounds dangerous, man.
Yeah, so you do need to be wise about where you put that and how and so forth.
Yeah, makes sense.
But if that's not a part of her life, then the second thing we need to think of is probably an insulin resistance type thing.
So insulin resistance can result in higher testosterone levels in women, which is just super interesting. Will ultra metabolic help support a return to kind of a normal metabolic state?
Yeah, absolutely. And in fact, with the insulin resistance patients, then our recommendation is just simply one capsule twice a day.
Wow, that's pretty easy.
Yeah. Now, if we look at the diabetics, then historically these combination of herbs have been very beneficial for lowering and normalizing a patient's, say, their fasting blood sugar if they check that each morning.
So you're actually you're prescriptively using this in patients because you see a clinical benefit. I mean, we can't obviously offer this as a treatment for diabetes,
right,
but as a support for people that are dealing with these kinds of insulin resistance and blood sugar issues. You see a clinical result.
Yeah, and that's the way I approach it. I'm not prescribing it. It's not a drug.
Right.
But I'm saying that historically we understand that these botanicals have a very positive effect on metabolics, specifically in the insulin glucose mechanisms. And if we have our diabetics take it, now they do need to be mindful. They do need to be following their blood sugars.
Right, because you can go down too low, right?
Yeah, typically within 7 to 10 days, probably 80% are going to start seeing a very positive shift.
Well, that's amazing.
And many times they're going to need to start backing off of their diabetic medicines. But I probably have 6 or 8 of my patients that have come off of diabetic medicines just from the botanical products.
That's amazing.
And it's exciting because we not only see improving trends in their fasting blood sugars,
yeah,
but the A1C, which is a 90-day picture of what's going on with your blood sugar, we've brought people down from an A1C of 12 or 8 down to a nice range of 5.2, 5.4.
Yeah, with a normal range, a normal-ish range. So this is Ultra Health Today. I'm Adam Payne. I got Dr. Brian Frank here with me. We've been talking about Ultra Metabolic. It's a new product. You can kind of see it here. We'll probably flash up a nice thing on the screen. It contains Ultra Cur Pro, Ultra Berberin, which is also an N-acetylcysteine conjugate with berberin, and then a whole bunch of Ayurvedic compounds that you helped research that we would learn to include in this supplement. We're going to go to break, and when we're back, we're going to continue our discussion of Ultra Metabolic. So don't go anywhere. Hey everybody, this is Adam Payne and Ultra Life Today. Welcome back. I got Dr. Brian Frank here. He's the Chief Medical Officer for Ultra Botanica, an integrative physician, a fellow of the A4M, as well as former or current president of the American Academy of Acupuncture.
Medical acupuncture.
Medical acupuncture.
Past president. Yeah.
Past president. Just and a whole bunch of other stuff. I'm sure.
Yeah.
We've been talking about Ultra Metabolic, our newest product, which has been kind of on the back burner for 5 years here at Ultra Botanica. The foundation of it is two ingredients, natural ingredients that use our liquid protein scaffold technology. One is, everybody knows, UltraCur. Our curcumin scaffold allows it to absorb in the body. We're using the professional UltraCur to allow it to be much more concentrated. And then we're using UltraBerberin, UltraBur, which is a berberin N-acetylcysteine conjugate. That's the professional grade, allowing it to be much more concentrated. Plus, I think it's 1, 2, 3, 4, 5, 6, 7, 8 Ayurvedic herbs are included in this. And I got to tell you, it was a little bit of it was a struggle sourcing some of those Ayurvedic herbs. Why? So what is Ayurveda and why should we be paying attention to it, Doc?
Well, Ayurveda is a very, very old medical tradition from India.
Okay.
And so it has been around thousands of years. So it would be a South Asian medical tradition, somewhat similar to Chinese herbal medicine tradition.
So this is a native medical, natural medicine tradition that grew out of thousands of years.
Yeah, absolutely. And so much like you would have in TCM or traditional Chinese medicine,
sure,
you would have herbal practitioners and they would evaluate a patient and they would, make a concoction or a capsule or however they would provide a number of different herbs or botanical products for a clinical condition. In India, they had that as well through their Ayurvedic physician.
Now, do they do clinical studies with these things? Or?
Oh, yeah, it's very active.
It is very active.
Yeah.
So these are validated herbal, natural
yeah.
herbal medicines. But we're not using them as medicines here in the States. We're kind of getting
not
away.
Here.
We're getting away with a little bit of
supplements.
Supplements. They're Ayurvedic supplements. Hint, hint, nudge, nudge. Say no more. And these are valid. These have been used in traditional Indian dot feather Ayurvedic medicine to treat a variety of different metabolic conditions. So, what can go wrong with a cell that causes a departure from metabolic homeostasis?
Well, in my fellowship in anti-aging and regenerative medicine,
sure,
they presented to us a model of chronic degenerative conditions that's a bit different from conventional medical teachings.
So please explain.
So in conventional medical school, they would say, okay, if you have high blood pressure, that means you put the cuff on your arm or your wrist and the numbers are too high. But it's, pretty much that and stress. If you have diabetes, they typically look at it as, okay, your blood sugars are elevated. Morning or after a meal, you may even, if you have more diabetic problems, you may be spilling sugar in your urine.
Oh, interesting.
But in the anti-aging and regenerative medicine, or what some call functional medicine, they presented a triangle where at the base of the triangle was oxidative stress. And that in time persisting would lead to inflammation, chronic inflammation, and that would in turn lead to the third leg of the triangle of autoimmune condition.
Or metabolic dysfunction at the same.
Yeah, because the cells are recognizing themselves as invaders.
Interesting. So let's look at the triangle. Do you mind? So oxidative stress, that's because in the Krebs cycle of one of those things, it actually generates free radicals, right?
Yeah.
And if that Krebs cycle is a little bit damaged, it's creating more free radicals than it's creating energy. The efficiency.
Well, yeah, that's right. And if you want to look at a simple way about what is oxidative stress, if you take an apple and cut it and set it on the counter,
it turns brown.
It turns brown. Well, that's oxidative stress. Basically, it's botanical rust.
Oh, interesting.
If you throw a metal pipe out in the yard and let it sit, it'll rust.
And we're essentially breathing in oxygen all the time and using it as the fire to stoke the energy for our cells.
Right.
So we're creating oxidative stress all the time.
Well, oxidation is essential for life.
Right. Without it, we die.
But excess leads to essentially human cellular rust, if you will.
Interesting.
And so
what can we do about that rust?
So what we can do, I mean, for a number of years before we came out with this product, I had a number of my patients with diabetes that would do actually much better only on the UltraCur products.
Interesting.
But with this being a very comprehensive multi-botanical approach from an Ayurvedic tradition, it just allows the body metabolically, the insulin and glucose interaction to become healthier.
So from approaching it from multiple fronts, right?
Exactly.
Not just like the one mechanism of action. I liken it to like if we stopped all the traffic here in Oklahoma City going across I-40 at Rockwell, right? And said, hey, we've stopped all the traffic and we're going to make sure that no cars move across the river. It wouldn't stop the traffic. The traffic would just go around on the other bridges, right? And most of our cells have alternate pathways for doing something. And what we've seen clinically is that if you want to affect a metabolic or an operational pathway in a cell, you really have to attack it from a number of different directions.
Yeah. And so it's a complex formulation.
Right.
Took a lot of homework. But fortunately here, even in the first few months, I'm having reports from patients that are bringing me their, 2 to 4 weeks of blood sugars before they started it and after they started it. And we're definitely seeing, for almost everybody, we're seeing a very positive trending.
That's phenomenal.
Not only in their fasting morning blood sugar before they have their meal, but again, that A1C, that's always exciting to see that come down to a healthy range.
So you can get Ultra Metabolic at Dr. Frank's clinic, or you can go to ultratoday.com and look up Ultra Metabolic. I think we'll have a coupon code for the next couple of weeks. You can look for it online and get it at a discount and try it for yourself. Unfortunately, we don't have samples of Ultra Metabolic to give out like we do for UltraCur, but we do have a guarantee. If it doesn't work for you, you don't find any benefit for it, just ask for your money back. No questions, or maybe a couple of questions asked, but
because we want to learn.
Yeah, we want to learn. Exactly. So oxidative stress was the first part of the triangle. What was the second? What was the second part?
Inflammation.
And so we have a solution for that. Curcumin, right?
Exactly.
Curcumin and frankincense and devil's claw are great modulators of inflammation in the body. And then the last part is the metabolic dysfunction.
The
autoimmunity, which results from that dysfunction. So do you find that if you address the oxidative stress and the inflammation that you're helping people with most of what's going on?
Yes, and generally you may well see the autoimmunity subside and diminish. So really from a functional medicine standpoint, we don't look at high blood pressure just as a vascular, numbers on the cuff problem. We look at it as an oxidative stress, inflammation, autoimmunity. We look at diabetes that same way too. It's not just too much blood sugar or urine sugar. It's a autoimmune condition that has over time come from oxidative stress and inflammation. So these are good botanical products to try and address that.
Yeah. Well, do yourself a favor if you're dealing with what would you call it? Insulin resistance. And your doctor says, well, we might be considering getting you on some drugs to deal with your elevated A1C. Or if you're actually full blown out the door and your A1C is in the range when you need to be doing something, do yourself a favor. As a nutritional supplement to help support your health, try Ultra Metabolic. Everyone that we've seen in most of your patients, I think you've had one that said, I don't like it, right? But all the rest of them are pretty good.
Yeah.
About what percentage do you think are getting better?
Oh, I think certainly 85 to 90% have been seeing very favorable results.
That's awesome. Yeah. Well, this has been Ultra Life Today. I'm Adam Payne. We got Dr. Brian Frank here. Thanks for joining us this week, and stay tuned for the live portion of our radio broadcast. We look forward to chatting with you and hearing your story. Thanks for joining us. Thanks, Doc.
You bet.